My name's Lakoumentas. The practice is now NDC Thompson Road, and I'm one of the 2 lead dentists in this clinic.
My name is Dr. Charbine. I'm one of the 2 dentists at NDC Thompson Road in Charbine.
When I was of the mindset it was time for me to relinquish ownership of my practice, I was looking at potential buyers, and NDC wasn't the first one. I had other companies approach me, but when I met NDC, we gelled as people. We were on the same wavelength with what our expectations were and what their role is and what our role will be.
The partnership model is what appealed to me. I remain the cornerstone of the practice, but there is support behind the scenes.
We know what works and what doesn't work, and we want to have the freedom to practice what's best for the patient.
The main concerns I had was related to my clinical autonomy, to my patient experience, and to the culture of the team in the practice. There were open discussions, and we were reassured that decisions will be clinician-led and the practice will keep a unique culture. The clinical decisions are always mine, while being supported and structures are in place, and the practice uniqueness has been respected. I find NDC's support is thoughtful and long-term. We've seen investment in dental chair, in autoclave, in compressor, and we've seen team development, upskills. So far it's quite good.
I was always, liaising with the bookkeepers, the accountants, the marketing people. I didn't want to do that anymore. And then there's human resources, staffing issues, and organising leaves and what have you. And now that's just taken off my plate, and I love it. It's not my responsibility anymore. I can just do what I love doing, which is working with the patients, and that's really taken a lot of load off my shoulders. The biggest value is we can see this practice growing with NDC as the backbone of the clinic. It's also allowed us to network with our fellow colleagues in other NDC clinics.
The value that's most important to me was stability and balance. The practice feels more stable with all the behind-the-scenes support, and the balance is, it freed my mental load, and I can just enjoy dentistry.
For me, it was an easier transition. The staff took a little bit longer, and I've spoken to my staff, one-on-one, and none of them have had anything bad to say about NDC, so they're very happy with the support they're receiving.
Being part of a broader network opened up more career pathways for them, and more development, and it boosted their confidence in the practice. It's exactly that, the community sense. When I attended the NDC Summit last year, that was the first time, I saw a different side to the corporation. I felt the long-term vision and their forward thinking is quite aligned, and I felt I'm part of something bigger.
My advice is to speak to other people that have gone through this with different corporates and find out what their experience is. Word of mouth, as they say, is the best way to go moving forward, and that's what I did.